Hey guys, it's Dr. Todd Lloyd again with Udemy.com and with Rincon Chiropractic in San Francisco. Today I'm in my home studio in Sonoma, California again, and I'm here to bring you an update on some of the experimental literature I found while browsing for new approaches for neck pain relief. And this study I found is called The Effects of Lower Trapezius Strengthening Exercises on Pain, Dysfunction, Posture Alignment, Muscle Thickness, and Contraction Rate in Patients with Neck Pain. It's a randomized controlled trial, but it's a small study. There are only 40 neck pain patients in this study. What they want to do is look at some of the stuff that is important for neck pain sufferers to track or their doctors to track. They took these 40 neck pain patients and they grouped them into two groups of 20 people each. And with one group, they did standard physical therapy care. And with another group of 20, they did the standard physical therapy care, and they added some lower trapezius muscle exercises to see what kind of effect that additional exercise would have on their neck pain. So this is the standard physical therapy care that they did. Now, if you're a physical therapist, you might be appalled by this because, quite frankly, this is really basic care, and I don't think it really fits the standard of care for any provider to do. But the standard care they did for both groups, they did this scapula setting technique where they instructed the patient to depress and squeeze together their shoulder blades and hold that position. Then they did this upper trapezius stretch, which is fine, but I don't think it's very effective for long term. And then they combined the stretch and the scapular squeeze with some thoracic extension using a foam roller, which is a great mobilization drill. I use that a lot with my patients in the clinic. So this slide represents standard physical therapy care that they did for these patients in both groups. It actually worked out pretty well for them, but in group 2, they added these exercises. So they added this modified prone cobra, where if you follow what this guy's doing and you extend your mid back, your thoracic spine, and you elevate your chest off the table and you elevate your arms off the table, this modified prone cobra will activate your lower trapezius muscle. Next, they did wall slides, which is actually a great way to squeeze together the shoulder blades, which activates the lower and middle trapezius. And you just slide your arms up and down the wall. You can try that at home. And then finally, they did C, D, and E, which is a trapezius muscle exercise. So as you can see in step 1, you hook your fingers back behind your head. The patient is lying prone. Lift your head off the table and then squeeze your elbows out, which will get your shoulder blades to squeeze together more too. And then you progress through a harder challenge of doing this exercise where then you do the same thing. You lift your chin off the table, but you don't have your fingers interlaced. They're kind of like in this expanded position, and you roll your shoulder blades back as you extend off the table, kind of like doing another modified cobra technique. And then finally, you can go into this Blackburn Y position, which will more efficiently fire the lower trapezius fibers. Now, if this were me, I would try this on your bed at home, but I would also try it on a big Swiss ball that you can roll on, which can provide a more of an unstable surface. In this study, they also measured the size of the lower trapezius muscle using diagnostic ultrasound. With diagnostic ultrasound, you can bounce an image through the soft tissue, and you can see this layer of muscle where the trapezius is, where they can measure that. So at the beginning of the study, they measured it, and at the end of the study, they measured it too. When they did these exercises, they were done 3 times a week for 4 weeks. And with the intervention group, of course, when you do the progression exercises, they must have had a way to instruct those patients to progress through those as you go along. You get stronger and stronger, you get better and better at doing it. You have this neuromuscular training that happens where you get better at doing these exercises and it becomes more efficient, which is one of the goals you want to do. All right, so at the beginning of this whole treatment, they measured some stuff. They measured visual analog scale, where you rate the amount of pain that you're in on the scale of 1 to 10. And because it's a visual analog scale, you have this timeline continuum on your paperwork where you can go, my pain today is somewhere over here. And then how you're supposed to do this is you take a ruler to measure out where on that scale you are. Maybe it's like 10 centimeters. And then you can rate that by just measuring it out. So there's also a neck disability index. This is a really common thing to do where you have, there's 10 questions that you can answer where you can rate how much of your day-to-day life, your daily activities is being affected by the pain. Sleeping, caring for yourself, taking a shower, reading a book, getting into your car and going somewhere. All this stuff is rateable, and it's on this questionnaire that people fill out. So you have a score of 50 out of 50 when it's the most difficult, or 0 out of 50 when nothing is wrong. So that's a evidence-based disability index that you can fill out. They also measured posture alignment, where you take the patient, have them turn to the side, and you can measure how far forward their head is. And you can chart that down as an objective measurement. Muscle thickness, they used ultrasound to measure the muscle thickness, and then muscle contraction, they probably used a surface EMG machine for that. So you can measure how fast the muscle contracts and how much force it uses. All right, so you had 2 groups of 20 each. What they found is that the group that also did these experimental exercises had better neck disability index, better postural alignment, improvement in muscle size, and improvement in muscle contraction. Okay, now as you can see here in this chart within the study, you've got the experimental group on the left, the control group on the right. And you can see that this angle here, this cranial vertebral angle, is the angle between the top of your shoulder to your neck. And then the CRA angle is the cranial rotation angle, which is how much your head is tilted forward, measuring this angle back here. And so this cranial vertebral angle measures your head forward translation roughly. And at the beginning of the intervention, the randomized group were about the same, 47, I guess that's degrees. So post-intervention, they both improved. The experimental group improved by 5 points, and the control group improved by 2 points. So yeah, 4 points and 1.7 points. And then the cranial rotation angle, the experimental group improved by 4 degrees, and the control group improved by 2 degrees. So it's roughly double the effect if you do, I guess maybe double the exercises. So muscle thickness. If you do the lower trapezius exercise muscle exercises, then you can expect your thickness to improve 0.1 millimeter, centimeter, 1 millimeter. Hardly any growth with just the regular wall slide exercises and the muscle stretches. Yeah, so this is millimeters. It's 0.1 millimeter, which doesn't sound like a lot, of course, but when we're talking about muscle thickness, it's actually a good difference. Especially when it starts out as 0.5 millimeter of thickness. It seems like it should be thicker than that. Maybe this 0.5 centimeter. It's got to be 0.5 centimeter. Got to be. Oh, muscle thickness and contraction, muscle thickness and resting. No change. So when you contract the muscle, it's bigger. Contraction rate, it's got a percentage assigned to it, 1.8 to 2.2, and there's no change within the control group. Self-reported pain level, no change between the two groups, but the neck disability index has an improvement of 6 points for the experimental group that did the exercises and 4 points for the control group. So everyone got better, but if you do the exercises, you get better faster. So concludes this study here, talking about the effects of lower trapezius strengthening exercises on pain, dysfunction, posture alignment, and muscle thickness. That keeps you up to date. These are some new things to try for your neck pain and your posture, and it has been proven to have an improvement. So enjoy doing those.